Grey's Anatomy, why do you have to make it weird all the time? Hey there, old person watching YouTube. If you're new here, hi, my name is Ajay. I'm a doctor from India. If you're already subscribed, welcome back. I love you to the stars and back. Grey's Anatomy is probably the most medical TV show with its roughly 25,000 seasons. But today I'm going to be reacting to season 2, and apparently it involves bombs. So surgery and bombs, that should be a nice combination. So let's go. But before we begin, let me just mention that it's been quite a long time since I watched Grey's Anatomy. I don't think I've watched much as well. Probably a few episodes in the first season and a few in the second season. Maybe the whole of first season. I don't remember. I know the characters, what they do and all that, but I might get their names wrong and I might get their, subspecialties and specialties wrong. So if that happens, please excuse me. Let's start.
Quiet ward. I know.
Never say it's a quiet ward. Never say it's a quiet day at the hospital, because it always turns out not so quiet if you actually say that. But then this board is how we, not me, but how the surgeons in surgery department, if I'm working in surgery department, is what we'd be doing. So we'd put all the details about whatever procedures are planned for the day, just so that someone can, come look at it. The surgeons, the anesthesia team, the nursing team, anyone can look at it and see what's planned for the day. This in India is maintained by the surgery team, like the youngest, like the junior residents would be doing it. I don't know how it happens in the US. I think the anesthesia team might be maintaining it because they are the one who are gonna get the whole thing running. But basically it's gonna be like the patient name, his age, what procedure planned, who's the surgeon gonna be, who are the nurses gonna be, who's the anesthetist gonna be, and things like that. So that you can just walk in and see, who's operating on who and whether the surgery has started, whether it's completed, just to make things easier for everyone. Okay. That's intense. Okay.
Dude.
So basically, that lady's got her, the paramedic has got her hands inside the chest wall. Maybe there's a bleeding, and when there's a bleeding, it's like tamponading. You put pressure on the bleeding and hope the bleeding stops. That's how bleeding stops, put pressure on it. I think that's what they're doing, but let's see.
Vitals?
Tachycardic in the 140s, BP holding in the 90s.
So basically, tachycardic means like the heart rate is more than normal. So 140 is obviously abnormal. So we say 60 to 100, sometimes 110 to be the normal range. So anything above that is tachycardic. Anything below that is bradycardic. So lower heart rate, if someone's heart rate is like 45 or something, we would say it is bradycardic. So you guys know what BP is. So
Let's get him intubated and place an occlusive dressing over the wound. Now you.
Hannah Davies.
Hannah, why do you have your hand inside my patient?
I'd like to say for the record, but I told her not to.
I tried to tamponade the wound with gauze.
yeah, so tamponade the wound. Like if there's any wound, any bleeding anywhere, you put pressure on it so that the pressure buildup is gonna prevent blood from oozing out.
You have your finger on a major bleeder. Mr. Carlson is running out of time. The only thing that you have won is an all-expense-paid trip to the OR. Dr. Gray, prepare to transport her to the OR, and let's make this happen quickly, people.
So basically, if she takes her hand out from the bleeder, the bleeding vessel, the artery, it is gonna be an artery, because if it has to bleed so much, it needs a lot of pressure, and arterial blood will be under pressure. Like when we see the blood pressure, that is the arterial pressure. So if she takes her hand or a finger out of that artery, blood is just gonna splurt like it's coming from a big hose. So that's what they're trying to stop here. So she's gonna probably have her hand inside the whole time. They go to the OR, and in the OR, which is the operating room, we call it the operating theater in the UK and in India. So yeah, when you have that, you take the person in And once she takes her hands out, the surgeon has to start operating to prevent it from, bleeding again.
We got Tucker Jones, age 35, lost control of his car, hit the
He's got
guardrail,
a
flipped
chest
it. He's got
contusion and head CT shows a left-sided depressed skull fracture and temporal epidural hematoma. GCS 14 in the field, now down to 12. His motor exams are
Okay, let's get him on a gram of Dilatin and 70 grams of mannitol.
I'm on it.
Mr. Jones, I'm gonna need to do an exam.
Okay, right, let's go back and let's see if I'll try explaining whatever they're saying.
Okay, what do we got? Tucker Jones, age 35, lost control of his car, hit the
He's
guardrail,
got a
flipped
chest
it. He's got
contusion and
So chest contusion, basically there's like an injury on the chest, just leave it at that. Head CT shows left-sided depressed skull fracture. So depressed skull fracture means like a part of his skull just fractured, that's gone in a bit, and that would probably cause
head CT
bleeding
shows a
inside.
left-sided depressed skull fracture and temporal
Temporal
hematoma.
epidural hepatoma. So temporal is the temple region. So there's an epidural hematoma, which basically means outside the dura mater. So basically it's like right inside the skull bone, between the skull bone and what we call the meninges, the layers of the protective layers of the brain basically. So it's there in between them. So yeah, that's because of the injury. And how much is the GCS?
Hematoma.
Okay. GCS means Glasgow Coma Scale. This is something that we use to assess how the brain is after an injury and all that. So they say at the field when the paramedics got them, it was 14, and now it is down to 12, which means the patient is deteriorating. If it goes to 8 or anywhere below 8, we'll have to intubate the patient and put him on a ventilator because he can't breathe on his own. So 12 is still okay-ish, but because it's reducing, it means that we have to do something about it. Otherwise, it's going to reduce a lot.
Okay, let's get him on a gram of Dilatin and 70 grams of mannitol.
I'm on it.
I don't know what Dilantin is, but mannitol is like kind of like absorbs extra water from the brain and everywhere in the body. So basically, when the brain is injured, there's going to be some edema, swelling of the brain, and that causes even more injury as it swells because the skull is like rigid structure, right? So the skull can't expand. If the brain is expanding because of swelling, that's going to cause damage to the brain itself. So mannitol reduces swelling in the brain. So that's basically why they're giving it.
How are we doing?
Stabilize.
That's actually the right way of getting into the OR. You would have washed and scrubbed your hands thoroughly up to the shoulders, but if you hold your hands down or something like that, all the water from here is going to come to your hands, and you wouldn't want that because this is the part that's going to be operating. Even though you wear gloves, we just want to keep it as clean as possible. So you hold it like this, and obviously you don't touch the door or anything. You push it with your back and you go in. So he did that right.
He shot himself with the bazooka.
Like I said, morons, the pair of them.
Was there an explosion?
Huh?
Was there an explosion?
No. Why?
Oh, crap.
Okay, everyone. I'm going to do a thoracotomy, and Hannah here is going to pull her hand out. Dr. Gray.
Basically, thoracotomy means opening up the thorax. Thorax means the chest wall. So it's gonna open it up on the sides and then explore it and see what's there.
Gray is going to clamp the bleeder when we have more exposure.
So basically, when the bleeder is the artery that is bleeding, so what we do is we put clamps on either side, repair it, and then we release the clamps so that blood can flow through normally.
Ready?
More than ready.
Scout. Curative. If you interrupt me in my OR, I bet before a
Was
good
it
damn
through and
reason.
through?
What?
The wound on James Carlson, was it through and through?
No, it was just an injury. No exit. Why?
So that means whatever the projectile, whatever, it's a bullet, rocket, whatever, it's still inside the body and it can explode, right? Because it seems unexploded.
I'm sorry, Code Black.
Code Black. Tell him that I am sure, and then tell him to call the bomb squad.
Okay. It's Code Black. Code Black means there's a bomb threat to the facility. Right, that's fun.
Hannah?
What if I just take my hand out really quickly?
We'd have to ask the bomb squad that when they arrive. But I'm guessing that would cause the ammo to shift and explode.
Hey, somebody help here.
Sorry, got you.
I think I'm just gonna take it out.
You made it almost to the finish line. You can do this.
No, I just want to take it out.
How the hell did a hand get in just like that? So, it's got really fast hands. Well, so that apparently is the end of the episode, but then they haven't finished the whole thing, and that's going to be another episode, I guess. I think that's going to be episode 17, but we can't do a reaction to that because it's going to be like some 40-minute long reaction video. We don't want that to happen. So maybe let's consider this to be the part 1. Maybe some other time we'll do the part 2 as well, but hopefully you liked it. Pretty intense, you know, this doesn't happen in a hospital like this. So much drama doesn't happen. It's usually just boring. But yeah, it's a TV show and they have to make it dramatic, so it is dramatic. Also, I have to tell you that I conducted a free Unacademy class last Saturday, 8th of May at 4 p.m. Indian time about how medical training is structured in India and all that. People seem to like it, if I can say so myself. And this week is all about becoming a specialist doctor in India, UK, US and Germany. So basically in India and abroad. And it's going to be on 15th of May, that is Saturday at 4 p.m. Indian time. You can follow the link in the description and in the pinned comment and use code Dr. A to unlock Unacademy. And if you want to join for Unacademy Plus, you can use the same code to get 10% off. That being said, I'll see you in the next video, also on Unacademy this Saturday. So till I see you again, stay happy, stay healthy. Bye-bye.